Thank you. Thank you for inviting me, and thank you to everyone who worked on what is definitely a timely and very detailed report. I have a few prepared remarks from the point of view of a donor, but I just wanted to note, although I'm sort of purely health these days, 30 plus years ago I was an economist working on farming systems research, indigenous agriculture, and agroecology. So I always really appreciate the chance to read something that takes me back into where some of those things are evolving or still being talked about. But one of the main things that struck me in reading the report is that the whole discussion on food systems mirrors very much the discussions that we have in the health sector on health systems. We're looking at a lot of the same issues: access, quality, behavior, and behavior change. We're looking at a lot of the same drivers. We're looking at a lot of the same issues around diversity of situations within countries and even regions. And I was, thinking about, as I was reading it, my last post before Washington was Kenya. And Kenya is a great example of a country that's got all three of those system typologies happening at the same time in different parts of the country, and lots of different things going on that challenge, in a health system perspective and the food system perspective, challenge how we address nutritional issues for the country. Not to mention the almost famine that happens fairly regularly and we're in right now. In terms of USAID as a donor agency, I think we very much recognize that food systems play a critical role in influencing health and nutrition. And we appreciate the report's recommendations and specific actions for policymakers and other key actors. I think, as I sort of alluded to, we take a very multi-sectoral approach, and in fact are guided by a multi-sectoral nutrition strategy and a global food security strategy that is focusing on investing in nutrition to reach as an important way of reaching our overall development goals. So it forces us, or it enhances the work that we're already doing to improve coordination across multiple sectors and platforms. Many of the recommendations made in the report heavily align with our nutrition priority actions. Again, multi-sectoral programming, specific measures needed for ensuring vulnerable and marginalized groups have access to optimal nutrition. We specifically work on the 1,000 days as the critical period for our focus, and the importance of that period, of course, for helping children grow into strong, productive citizens and promote self-reliant societies. The recommendation for looking for the greatest synergies for improving nutritional outcomes within existing spending on agriculture and food systems definitely resonates for us and our partners. The food system is not only a source of food, but a source of livelihood for millions of smallholder farmers. And focusing on nutrition is essential to viable food systems that ensure people have access to safe, nutritious, and affordable food year-round. I think the report also highlights the critical need to invest in communities' capacities and resilience, another important area for USAID, to address some of these devastating impacts of natural man-made disasters and displacements. And, excuse me, and the strain that and negative impact that has on nutritional outcomes and food systems. The conclusions that we need, the report conclusions that we need better governance and accountability to have a coordinated multi-sectoral enabling environment, as well as the emphasis on leadership coming from governments and intergovernment organizations aligned with our priorities for the future of development. Our USAID Administrator, Mark Green, is emphasizing that USAID looks to building capacity among our partners, moving towards the day when countries we support can take over these programs themselves. The report so clearly outlines the critical message that success in reducing malnutrition, improving diets, and enhancing nutrition outcomes requires increased financial and social investments. Helping countries to mobilize domestic resources and motivate increased private sector investment are two of the key avenues for doing that. I'll take another minute. Although we have a long way to go, we can't discount, of course, the substantial action that's been taken to move towards these goals in recent years. As an agency, USAID has reached over 27 million children under 5 through nutrition-specific and nutrition-sensitive interventions. And as a U.S. government, we've increased interagency coordination and collaboration on nutrition investments through the Global Coordination Plan. And of course, as a global nutrition community, we've made market improvements in mobilizing resources for nutrition and building capacity through coalitions such as the Sun Movement. In reading through the end of the report, another phrase caught my eye: an ability to be bold in ambition and imaginative in partnership, which is mentioned as one of the keys to identifying and seizing opportunities for change. It reminded me of something called the Development Impact Bond to save the lives of mothers and newborns that we just launched in India. Our administrator described it as just one step toward bold new ways of doing business. And so, to close, to say that we at AID are exploring imaginative partnerships and creative approaches to improve our development efforts, and that includes nutrition and food security work. And we look forward to working with all of you on this important effort.